Hey guys, welcome back to the channel. My name is Chisel. I'm a plastic surgery resident at Safdarjung Hospital, New Delhi. So it's been around 10 days that I've joined Safdarjung Hospital. So in this video, I'll share with you my experience of first week as a plastic surgery resident, and I'll also share with you my weekly schedule for the next 3 years and what all do we do as M.Ch. Plastic surgery resident. So let's begin. So my first day was a Monday. I joined on the 21st of December, and Monday was a ward day for me. So on ward day, what we have to do is we have to look after all the patients in the wards. Like we have a burns ward, we have a plastic surgery ward, and we have an ICU as well. So we have to look after all the patients. We take our rounds, me, my second year senior and third year seniors. We all together take rounds, settle all the patients, look into the issues they have. If any problem is there in the ward, we settle it out. And then the consultants come for round and we all discuss about the treatment plans of the patient and what we need to do for the particular patient. The unit in which I am posted in has a team of 8 doctors. We have 3 consultants and 5 senior residents. So 8 of us together work to make sure the ward is doing well on that day. So I, being the junior most, is the first person on call in ward that day. Whatever problem happens in the ward to any patient, I will have to attend till 4 p.m. before the evening team takes over from us. Second day of the week is plastic OPD for me. We see new patients of plastic surgery and we also follow up our old patients who need dressings and wound management and other surgery related complications which happen in the follow-up period of the patients. So we sit in the OPD, we see patients, we do their dressings, and I, being the junior most again, I will have to do a lot of dressings on that day. And that is how I am going to learn management of wounds of plastic surgery patients. I see some patients as well and I do a lot of dressings as well. In the coming couple of months, when I get used to the process and I know how things are done, obviously my speed of dressing will increase and I'll be able to give more time to seeing the patient and examining the patient and deciding the further treatment plan of the patient. Also on OPD day, we admit patients for surgery next day, and after the OPD is done, we will be proceeding to the wards and completing the pre-operative works of the patient and make sure that everything is set for surgery next day. So the next day is a long day because we have plastic surgery OT in the morning where we operate all the patients admitted, and after the OT is done at 4 p.m. we handle all the wards and emergency that comes after 4 p.m. that day. So we have to stay in the hospital all night, look after everything that happens in the department, and I, being the junior most, will obviously be the first person on call. And if I have a doubt, if I think I will not be able to manage a particular patient, I call my senior and the chain goes up that way. In the emergency, we handle burn emergencies and plastic surgery emergencies. Safdarjung, being one of the largest burn centers in our country, does receive a lot of burn patients and we give them primary treatment. We admit the patients and take care of them. And we also see plastic surgery emergencies like patients of trauma, limb traumas like tendon injuries, arterial injuries, other crush injuries of the hand, industrial injuries. So a lot of reconstructive surgeries happen in emergency that night along with management of burn patients. So after spending the whole night in the hospital treating burn patients and plastic surgery emergencies, at 9 a.m. we hand over the emergency to the next day's team and we make sure all our patients are settled. If there is any pending case from the night, we finish it off, we take a round, we make sure our previous day's admitted patients are doing well, and I go home by lunchtime to have a nice deep sleep and feel refreshed for the next day, which is burn OPD and morning casualty again, where we see our follow-up patients of burn injuries and we also see all kinds of burns and plastic surgery emergencies till 4 p.m. that day. And again, if we have patients to be operated, those surgeries will go on all evening, all night, maybe, who knows. And also before going home, we will make sure all the patients are ready for surgery next day. As Saturday, the last day of the week for us, is again OT, where we have a list of patients to be operated. They can be the burn patients or plastic surgery patients. So it depends on the type of patients we have on that day. And once the OT is done on Saturday, we have a weekend off as of now because we are in the times of the pandemic. Otherwise, usually what we have to do on a Sunday is go in the morning, look after the patients which are admitted under us and make sure everything is fine and come back by lunchtime. So that is how my weekly schedule is. I'm still getting used to it. I'm still getting used to the way things work at Safdarjung Hospital. I've enjoyed it so far, although it was a little overwhelming as it was a big hospital, so many patients, a huge department. I was feeling like, oh my god, where have I come? How am I going to manage all this? But now, since I have spent 10 days, I am feeling a little comfortable. Seniors are nice, the department is very helpful, the consultants are nice, and they make sure you are comfortable at whatever you're doing. So that is all what you look for when you move to a new workplace, having helpful seniors and a good working environment, and that is what I'm getting here. So moving to a new workplace and a place like Delhi does make you feel a little homesick, but that's how our life is as doctors. And when I'm at work, I don't feel lonely or sad because I am in the company of my patients. And everything I'm doing I'm doing it for someone else, for the good of someone else. And that is an amazing feeling. No matter how hard it is for the doctor, it can never be as hard as it is for the person on the other side who is actually suffering from all that disease. So after a week, when I look back, I realized that while I was having my own struggles at my new workplace, I did touch so many lives and help so many people. And that is an amazing feeling. And that is why it is all worth it. And I'm sure I'm going to have wonderful 3 years in this hospital doing what I love. My name is Chisel. You are watching The Tech Doctor. Namaste.